The signing of the National Health Insurance Act into law has triggered an immediate response from the private healthcare sector, culminating in a major legal challenge. The Board of Healthcare Funders, a body for medical aid schemes and other healthcare funders, has launched a legal bid to contest the constitutionality of key aspects of the Act. The action positions its members in direct opposition to the government's flagship healthcare policy, setting the stage for a protracted battle that could determine the future structure of healthcare in South Africa. Let's talk more about this with Managing Director of the Board of Healthcare Funders, Dr. Katlego Mothudi. A very good afternoon to you, Dr. Mothudi. Thanks very much for your time. How much of this really has to do with you disagreeing fundamentally with the authors of this law, rather than a problem that has to do with failure by Parliament to conduct a proper public consultation process?
Then good afternoon, Mr. Mvoko, and thanks for having us. I think the issue of ushering in this new law has been marred by the procedural problems that we've identified, not only through Parliament, but also in the first part of our case, where we found fault with how the President handled the submission. And I would also hasten to say that it is out of interest of making sure that the introduction of universal health coverage to our country is beneficial to everyone. From our assessment, there was very little consideration of all the challenges that were brought forward since the advent of the Green Paper and right up to the part where this went through Parliament. So this, I would say, supplementary submission to our first challenge looks at how Parliament erred in terms of handling this new law.
Did Parliament necessarily err, or is it the fact that you are actually disagreeing with a decision that they've considered and took?
We disagree with the lack of, firstly, public participation that supposedly happened, but whose input was ill or not even considered. And we believe that as legislators, or those people who are given the responsibility of putting together laws, they should be cognizant of making sure that they've got all the facts correctly, and those that are put before them are actually considered. So it has a lot to do with how they have engaged with the content of the law and then the interaction of the general public.
What would have satisfied you? What would have suggested to you that they indeed gave everything the careful consideration you're saying it deserves?
I think two major components. The first thing is when you are presented with the need to craft a law, you must make sure that you've got enough information. Now, there was very little, if any, information on how the fund will be structured, how the benefits will be structured, and also how much it costs. We feel that the department, in the submission of this proposed law, gave very little to go from for decision making. Secondly, there were many entities. We are told there were thousands of submissions that were made orally and even submitted electronically and otherwise. But if you look at from the Green Paper, the first drafting of the Act, there are very little changes despite all this that were inputs that were given into the process, which means that this was expedited in spite of the concerns that were raised by those who took time to make contributions.
Now, what relief are you seeking from the court?
As we've done with the previous submission or the first part of the case, we are asking the courts to send the bill back to Parliament and to actually consider all that has been put in front of it. There are many issues that are raised. We think that there's potential constitutional infringements which will impact on the access to healthcare services. We want to be sure that whatever is put in the law is something that is affordable, something that we are not entirely convinced of right now. We also want to be convinced that everything else that needs to be done outside of the Act to prepare for the smooth ushering of the new dispensation has actually been catered for. I think we've seen many examples of the many other things that should be considered. For example, the health workforce, issues of how we handle medicines and technology, the issues of leadership and governance, that even if this law and the fund is set up, will still leave the status of our healthcare as poor as it is currently. There's also very little harmonization that is considered when you look at the public and the private sector in terms of how they would work together. In fact, we think that there is a proposal to rather dismantle the little that we think is working to make space for ushering an unknown entity.
Now, earlier, you had applied to have the president's record of decision in this matter submitted to the court. That ruling, of course, is being appealed. In this specific instance, is it just about Parliament or the president as well?
It does include the administrative process that ends up with the president signing into law. But the focus on, or rather in this submission, is also to examine how Parliament actually disregarded the many submissions that were given to it, and how even afterwards those submissions did not have an impact on their final decision.
Dr. Katlego Mothudi, thank you very much for your time. Managing Director of the Board of Healthcare Funders, following their fresh bid to legally challenge the signing of the National Health Insurance Act.